Brad Holland, thank you for joining me. We have Brad Holland, CEO of Hendrick Health, here with us today. I'm Marshall Morris with First Financial Bank and also the chair of the chamber. We're going to visit with Brad briefly about things that we're experiencing in our community, challenges that the healthcare system is facing, and allow Brad to help educate us and guide us down these next few months. Brad, thanks for taking some time.
Marshall, thank you. It's a pleasure to be here.
First off, tell us about, I think there's some confusion around the governor's orders about the 15% capacity issue that we're facing and some of those implications. Can you help clear some of that up?
Yeah, this is a difficult subject, but I'll try to make it as simple as I can. Most recently, the county judge misinterpreted the governor's orders and quoted that the hospital had just recently breached the 15% order, but the governor was very clear in his definition of that 15% threshold. And basically, the governor is using the definition of COVID admitted patients over total hospital capacity. And that is the definition. The judge quoted COVID admitted patients over hospital census. And so that denominator is radically different. And so we truly are in the hospital here in Abilene, COVID admitted patients are 16% of the other admitted patients in the hospital. And so he used that statistic, but the definition from the governor is total hospital capacity. And hospital capacity is what are the number of available beds out in the community or the 22 county region that makes up our TSA, or we fall under something called TSA D, Trauma Service Area D, which is Abilene and the surrounding areas. But that includes beds like rehab beds, psychiatric beds, the hospital beds in Haskell, the hospital beds in Hamlin, Sweetwater, Anson, and those are available capacity. And so our available capacity is in excess of 872 available capacity beds. And so when you add that huge denominator in there, it drives the percent down to about 8 or 9% where it is today.
So in line with Judge Bowles's comments, you might say we are in a more serious situation than the governor's number would make it seem.
This opportunity came up, and I had the pleasure of presenting to City Council today at the pleasure of the invitation from the mayor. And I was greatly appreciative of that opportunity to come and, in essence, give a status update on hospital capacity and the challenges. And that's exactly the alarm or the bell that I'm trying to ring is we are out of ICU beds in TSA D. So Dr. Lowry had been on the news recently saying that he did not think we were going to meet the TSA threshold of 15%. And that's why, because our denominator really is not representative of the beds that truly treat COVID patients. They're not going to treat COVID patients in a rehab hospital. They're not going to treat COVID patients in a psych hospital. But that's why we're only at 8 or 9%. However, we have no ICU capacity. As of this morning, there was only one ICU bed available between Brownwood, Hendrick Medical Center South, formerly Abilene Regional Medical Center, and Hendrick Medical Center Main. There were 0 ICU beds. The only bed in our TSA, which is 22 counties, was in Sweetwater.
Wow. So obviously that's concerning if you do have COVID and you're struggling with it. But what's some of the trickle down effects for others when there's a lack of ICU beds?
Well, what we do is we shift resources every day at this point due to the tight capacity that we have. We look at our schedule every day. It's led by our anesthesia providers and our surgeons, but we cancel these elective cases. Well, elective means that there's only a certain number of specialties that go in the ICU because that's where the bottleneck is. Elective, by their definition, is bypass heart surgery, craniotomies to relieve brain surgery, and trauma surgery. Those are the only other specialties that go in the ICU that could be put off. You can't put off trauma. So the only things that we can delay are brain surgery and heart surgery. And so I'm not sure most people would consider that elective, but that's what we postpone.
So some might suggest that this surge should have been expected with school going back, with life returning to normal in the fall. It seems we should have been prepared for this. Were we unprepared, or can you speak to some of that?
Well, when you say the word we, I guess the question is who falls into the word we? The hospital did anticipate this. I think the hospital's argument is we did expect it, and that's why we've been very vocal about being more cautious, limiting the gatherings. Just because kids go back to school, that didn't mean COVID was eradicated and we need to continue to practice like it had been. It's probably more reasons to be diligent if kids do go back to school. But that's not exactly what happened. I would say that kids did go back to school. They were very diligent about masking, but all of a sudden the extracurricular activities happened. The convention center went back and was booming. And so we've been a little bit vocal that, yes, we need to open the economy, but maybe we shouldn't have been so, the spigot maybe shouldn't have been all the way open. We probably should have been a little bit more cautious. As far as the hospital goes, we can't just go out and recruit more ICU nurses, but we have started to cross-train staff. We have started to look at overflow scenarios, and we do have those overflow scenarios that we use on a daily basis. Just because we're full in the ICU doesn't mean that we don't have phase 1, phase 2, and phase 3 overflow strategies. We do, and we are prepared for that. But those are on an as-needed basis. That shouldn't be expected of the hospital when we should all be probably pulling in the same direction as a community. You don't want to be treated in an overflow unit for your ICU care. You don't want to be treated by a nurse that's not ICU critical care trained. But when you're in a global nation and state pandemic, there are no more ICU nurses. So everybody's after the same labor pool. So you just come down to a supply and demand issue at some point.
So it's not space, it's not time, it's not resources. Really, what prevents us from adding ICU capacity is the ability we can't create new ICU nurses, and we're competing with everyone else. Is that right?
I would say that's almost the simplistic explanation. When Hendrick Medical Center purchased Hendrick Medical Center South and Hendrick Medical Center Brownwood, they actually have empty ICU rooms. They just couldn't staff them. And as of today, we actually this week had gone out to the state of Texas and asked the state of Texas to provide us 93 nurses out in this community, and 30 of them showed up today. That the state of Texas, on a basically an emergency basis, recognized what's happening here in TSAD and have provided Hendrick with access to nurses that short of us acquiring those 2 other hospitals, I'm not sure what we would have done. So we now have the ICU capacity, and the state has lended us some nurses on the short-term efforts to help fill those beds. Last month alone in October, we turned down 60 transfers from the rural hospitals and regions around us for ICU care that we couldn't meet.
Wow. So Brad, from the viewpoint of the Chamber of Commerce, there are 2 important groups that have been impacted by coronavirus. We have those with underlying health conditions and that are really experiencing COVID as a disease. And then we have the businesses and employees that create our strong economy. What can we be doing as a community to help make sure that both of those groups are seeing success?
This is where I had to come to ask the city leadership for help. I'm just a guy that runs a hospital. I'm not an epidemiologist. I don't come up with public policy. I'm not an elected official. So what I can do is give you my opinion. But it's my opinion, and I have no ability to control these controllables. I want the economy to be open. I am not advocating to shut one thing down, but we need to keep our schools open, and we need to keep our kids in schools. I think that's critically important. But you're putting education at risk by too many extracurricular activities, as an example. That's putting kids at risk, and I'm not sure that's the intent. You look at, I'm not sure we need to be hosting statewide functions here in this community. I think coming up, and I've told the city this, we're hosting, I think, the statewide tattoo convention here coming up. We've held statewide rodeos. We're holding statewide Christmas in November, as an example. Those don't seem mission economically critical to me. It seems like an opportunity for some serious super spreader events. But I think we have to critically look at ourselves as an economy and say, what do we need to do to keep restaurants open? What do we need to do to continue to go to church? What is the basic essentials that we need to continue to do to get through this together? And if they're non-essential, maybe city leadership and the community leadership and others should take a hard look at that. And if you're gonna do it, you better ensure 100% mask mandate as a minimum. Not show up in your mask and then take it off after you get through the front door.
Brad, a third group that has been greatly impacted is our frontline healthcare workers. What can we as a community do to show our support and to help our healthcare workers that have really showed up during this time?
I think exactly what we've said, and this is a hard one too. You know, we haven't identified one healthcare worker at Hendrick Medical Center, or I don't want to say none. Very few healthcare workers are getting COVID at Hendrick Medical Center treating patients, because we are very, very cautious. We wear masks, hand sanitizers, N95s, KN95s. We're cautious. Some of the healthcare workers that get it are the ancillary workers that might work in a physician's office, nursing homes. Nursing homes have a high number of healthcare workers that get infected. I don't want to say they're not getting it at hospitals, but very few are getting it at hospitals. If they do get it, it's because they went out and got it elsewhere in the community at a party or at the bar, or areas that maybe they let their guard down. And so what I ask the community is control your own controllables. If you got a healthcare worker, love on them, tell them thank you. But I employ every healthcare worker, as I wrote them all a note here in the hospital that says, wear your seatbelt. You can choose not to wear your seatbelt, but if you don't wear your seatbelt and you're in a car wreck, you're putting the hospital's ability to treat other car wreck victims at risk. And so wear your mask when you're out in public, because you represent the hospital, and you put the hospital's ability to treat patients at risk if you don't wear your mask. And I don't have control over that, but all I can do is try to appeal to their greater obligations.
Sure. Well, Brad, if there's one last thing you'd like to leave with those that are viewing this interview, things that we can do to help combat this virus and make sure that we keep our community safe, what would that be?
Well, again, the quote I use, Marshall, right now is control your controllables. You know, look at your business and control the things that you can control. I can't control the schools, but I can give suggestions. I can control my hospital. No one's going to get, very few people are going to get COVID while they're in the hospital, if any, because of the way we practice healthcare around here. So look at your own business, look at your own family, and control your controllables. I had to cancel Thanksgiving with my family, not because they have comorbid conditions, but my parents are in their 70s. Average age in the hospital right now is 63. So for COVID. So I just chose not to have Thanksgiving with them. That's a controllable I can choose. but I've made that personal choice for risk tolerance for myself. So I just ask anybody or any business, control your controllables to help the hospital.
Okay. Brad, thank you. We appreciate the hard work that you and your team do every day. Appreciate you spending some time with us. I do want to encourage those that are watching. We're going to have to find creative ways, safe ways to support our businesses through this. We can't be unsafe and let our businesses get shut down again, but we've got to find creative ways to support them. So Brad, thanks for taking some time. We appreciate it.
Thank you, Marshall, for the opportunity.
Mm-hmm.